The one thing that came to my mind as you were describing your day and all of you all trying to pitch in and work together was the value of communication with families.
So this is something that has always been near and dear to my heart. In addition to my clinical work and administrative work, I'm also vice chair of our ethics committee, and I spend a lot of time with family communication and dynamics. And we had actually, we're part of the SCCM Family Communication Initiative, so we were already rolling out some things when COVID hit. And so we have two programs set up. One program is utilized on the medical side, where we actually have non-critical care docs who go through the chart, who read the updates, and then touch base with the clinical team, and they call the families every single day. And that has been very, very helpful. On the surgical side, because we have enough people rounding, we have probably at least 3 to 4 people on rounds every day, with the surgeons as physician extenders, the intensivist, the APP, the residents. We divide up the unit and we call the families every day, but we establish it with a script early on. We identify who the one healthcare proxy is, the surrogate decision maker for our patients who can't make decisions, which is 95% of our patients. It's either the next of kin, or if someone has a healthcare proxy directive. And then we talk to them and explain that we are only going to we're only able to talk to one family member every day, and that the family should appoint that one contact person. And that person will get called by someone from the critical care team every single day. Weekends, every single day they get a phone call. Now they'll only get that one phone call, and that we ask the families not to call into the unit. So don't call and ask for an update from the nurses. The nurses are really busy in the rooms taking care of your loved ones. And if they have to keep coming out and taking off their PPE to answer a phone call, it's taking them away from the bedside. So when you explain that to the families and you tell them, you don't need to worry. Every day you will hear from us, and you'll hear from us after rounds. So it'll be sometime between 12 and 3. You'll get a phone call. And we also promise you that if anything changes, if your loved one takes a turn for the worse or something happens, we will also call you. So you don't have to worry that I'm not going to hear about something until the next day. And this has been just really, really successful for us in cutting down the number of phone calls to the units. You know, the nurses are kind of getting all stressed out with having to answer these questions, and how do I find the physician, and I don't know this answer, and they have so much on their plate to begin with that we want to, you know, take off whatever we can from the front lines. And this has really worked for us. And when you divide it up again, when you share the work amongst the team, it maybe takes us an hour after rounds to touch base with all the families.